Good afternoon, everyone, and welcome to this session on the American Rescue Plan and Safety Net Policies for Seniors. Our speakers for this session are Ann Swerlick and Cindy Huddleston. Ann has over 40 years of experience as a public interest attorney advocating on health, economic, and social justice issues. Since 2017, she has worked with the Florida Policy Institute as a senior policy analyst, focusing on healthcare and safety net program policy. Cindy Huddleston is an attorney with over 35 years of experience advocating to strengthen public assistance programs for low-income Floridians. Cindy is a senior policy analyst with the Florida Policy Institute, focusing on safety net programs for low-income Floridians. If you have questions for Cindy or Ann, please enter them in the Q&A tab at the bottom of the screen to answer during or at the end of the program. Thank you. All right, let's go.
All right, I will kick us off. Good afternoon, everyone, and thanks for this opportunity to really spread the good news on what's in the most recent federal COVID relief package, particularly for beneficiaries of critical safety net programs, including thousands of older Floridians. As Secretary Prudhomme emphasized, this is really a unique moment in time where we have this opportunity not only to, help people get through this unprecedented emergency and economic hard times, but also uses it as an opportunity to try to make some of these changes, which are systemic changes that need to be made permanent. The safety net programs have been given a substantial boost under the American Rescue Plan Act. That's the most recent COVID relief package and signed by President Biden on March 11th of this year. First, before we dive in, a word about Florida Policy Institute. We're a nonpartisan, independent nonprofit committed to advancing state policies and budgets that improve economic mobility and quality of life for all Floridians. And we do this by analyzing state budget and revenue trends, proposing policy options, hoping to encourage broad public education on these topics, discussion, and informed action. Aside from health and safety net programs, we also do a lot of work on tax and revenue policies, education, criminal justice, and immigration. So I encourage you to check out our website at floridapolicy.org. Okay, let's turn to the American Rescue Plan Act. I'm going to refer to it as ARPA. Next slide. So it includes multiple provisions, far too many for us to get into very much today. But just to kind of zoom out and see the 10,000-foot view, the package provides $1.9 trillion. And you can see for Florida, the breakdown of the different buckets of funding that will come to the state and localities. Some of you may already be aware, the session recently concluded, and in the 11th hours of session, the legislature made some decisions about how to use the $10.2 billion that you'll see on that first line of the slide. And that includes a number of school construction and transportation and environmental projects. But notably, the legislature decided to put $3.5 billion of these dollars in reserve. So we'll have to see how those get allocated in the future. Next slide. This, again, is a big picture view of the specific dollar amounts coming to Florida from various safety net programs. We'll talk about some of them, Cindy and I, this afternoon, and just the millions of Floridians that are going to benefit from the boost to these programs. Next slide. Again, our website has more detail on various aspects of the American Rescue Plan Act. These are a couple of papers and issue briefs that my colleagues have produced that are on our website. Next slide. Okay, now we're going to look specifically at healthcare changes. ARPA includes the most significant changes to healthcare coverage and access policies since passage of the Federal Affordable Care Act. And although all of the provisions I'm going to talk about today are temporary during the pandemic, during the public health emergency, we're hopeful that this is laying the groundwork for future policy discussions to make these changes permanent. Next slide. So specifically, we're going to look at a number of new state Medicaid options for increasing coverage and drawing down more federal funding. And when I say option, this means it's voluntary for the states, whether they tap in to many of these buckets of money. And some of that decision-making is coming up sooner than later. And we'll talk later on about some of the particular issues where there's looming deadlines. But we've got options around treatment, COVID treatment for vaccines and treatment for the uninsured, extending postpartum coverage for pregnant women from 60 days to 1 year. Very important for this group is enhancing and expanding home and community-based services. And there's also an opportunity to tap into more federal funds for community-based mobile crisis intervention services. We are also going to talk a little bit about some of the new resources available for mental health and substance use disorder services and to strengthen our public health infrastructure. Okay, next slide. So one of the items I sort of glossed over on the previous slide is one of the options that has been outstanding for a long time for Florida since 2014 is to expand our Medicaid program. And that would be to expand coverage for Medicaid to uninsured adults ages 18 to 64 that are at or below 138% of the poverty level. That's about $18,000 per year for a single person. Now, keep in mind, Florida's failure to expand has had particularly severe consequences for older Floridians. A recent study projected that there are 674 what's called excessive deaths. That's really deaths that were premature, that were conditions that could have been treated. 674 deaths annually in Florida for persons ages 55 to 64 who are at or below 138% of the poverty level. ARPA provides an incredibly generous 2-year financial incentive for our state to take up expansion. As you know, Medicaid is jointly funded through state and federal funds. And under normal circumstances, the federal government pays about 62% of the cost of Medicaid in the state. ARPA would provide the state a 5 percentage point increase in that federal assistance for 2 years. And it's projected we could see a whopping additional $3.5 billion in federal funding, more than enough to cover the cost of expansion. So while intended, this incentive to help states during the public health emergency, this financial incentive is actually out there indefinitely. So even after the emergency, public health emergency ends, if the state decides to take up expansion, they still can qualify for this very generous federal incentive. But it's important to note, even without this federal incentive, there are many savings the state would see under normal circumstances if we did expansion. And Florida Policy Institute did a study projecting about $200 million a year in savings budget savings if we expanded Medicaid. And again, we have many resources on our website. Next slide. Another Medicaid state option that's now available is one that builds on an earlier COVID relief provision. Under the 2020 Families First Act, states could opt in to getting 100% federal funding for COVID-19 testing of the uninsured. Now, with ARPA, that option has been expanded to include 100% federal funding to cover the cost of vaccines and treatment for the uninsured. That's regardless of what people's income is. If they're uninsured, they could get coverage through this category. This option is available for the state until more than a year after the public health emergency ends. To date, Florida has not opted into the testing option, and they still have an opportunity to do so and get an even better deal, 100% federal funding for treatment, coverage of treatment for the uninsured. Next slide. Now, I'm going to talk about another option under ARPA, which concerns postpartum coverage, which I know doesn't directly benefit older Floridians, but I think it will certainly give a lot of relief to grandparents, knowing that their daughters can get a full year of Medicaid coverage after the month of birth of the child. Right now, Florida has a separate category of coverage for pregnant women with income at or below 196% of poverty level. That's about, for a family of three, $43,000 per year. And during this time, women get prenatal care, but they also get full Medicaid coverage for whatever other health issues they have going on. Now, with ARPA, there's a new state option that after the birth of the child, the mother can get coverage. Now it's just 2 months, but now with this option, she could get it for a full year. And I'm really thrilled to report that the 2021 legislature has opted to do that. A shout out to Florida Health Justice Project, who spearheaded an awesome coalition of groups to help make this happen. And this is really fantastic news for nearly 100,000 Floridians who can be eligible for this coverage. This was part of the budget package that has not yet gone to the governor. The governor will have a chance to review and make, in general, make budgets, vetoes for the budget. We don't anticipate a problem, but it's not final until he signs off on the budget. Now, notably, there wasn't any enhanced federal incentives to take this up. And the legislature has actually wisely decided to make nearly a new $90 million state investment for these services. And of course, this is going to have a lot of payoff in the long run in helping both infants and mothers in a longer term with health issues. So to sum up, this is a really wonderful first step that Florida has taken to address maternal health and crisis in Florida, but it really needs to be done in conjunction with Medicaid expansion. It's really the most effective and fiscally responsible way of making sure that women, even after a year of coverage, that they're not dropping off the cliff and becoming uninsured, that they could continue that coverage indefinitely. Next slide. Home and community-based services. And this is one of these state options where there is an imminent deadline looming. That gives the state the option to draw down, and in Florida, it would be an additional $319 million of federal funding to help with home and community-based services, which of course help people stay in their homes and avoid institutional care. This benefits seniors, people with disabilities, and also medically complex children. Now, the feds recently put out some issue guidance for how these dollars can be used and what the state needs to do if they want to opt to get these funds. One important point is the dollars have to be used to supplement, not replace current spending on HCDS services. The big deadline looming for the state, if it's going to opt in, is January 12th. That's the date by which states have to submit to the feds an initial spending plan for this money and narrative. At this point, I'm not aware of any definite state decisions that have been made for Florida to seek these funds. I understand that there are policy discussions going on within ACA. I'm not sure how or if. I hope the Department of Elder Affairs is part of that mix. I know there's been some press about trying to get some of these funds to help with services for persons with developmental disabilities. But I think the main takeaway from this slide is if people have thoughts about first whether the state should take those dollars, and I just can't imagine anyone in this group would think we shouldn't, to encourage our state, our governor and our state officials to do that and to make suggestions on how that money can be used. Next slide. So ARPA and the guidance that the feds came out with gives some options for how states could use these funds. And you can see, a chunk of it can be used to bolster the provider workforce, which is a terribly important issue right now. We hear all kinds of stories of long-term care services being terribly understaffed. And so there are opportunities with this money to try to incentivize more people to come and fill these positions, either with payment increases, paid sick leave, retainer payments to keep people on. Could also use these dollars for emergency supplies, mental health and rehab services, helping to transition people from institutional settings to their individual homes. Finally, there's some discussion about, can we do anything to take people off the wait list? And the concern on the part of policymakers is that, this is temporary money, and it is money that's available. Let me point out, it's a 10 percentage point increase in federal assistance that runs from April 1st of 2021 through March 31st, 2022. So the concern is, policymakers not wanting to use this money to make an investment that might require a longer term investment. But personally, I think there's many good reasons to push back on that. Our wait lists are just shamefully long. And again, in the long run, this costs the state more dollars than trying to keep people, having people having to resort to institutional care. Next slide. Another option for the state is they could get Medicaid dollars, additional federal funds, to provide community-based mobile crisis intervention services for people experiencing mental health or substance use disorder crises. Again, this is recognition that there's a even more intense need for these services during the public health emergency. But again, those dollars come with the caveat that they must be used to supplement, not to supplant state dollars already being used for these services. The incentive is the state would get an 85% federal match for 3 years. Again, the regular match is about 62%. So this is a big bump in services, in funding, and it would be for a 3-year period. I do not know whether there's been any decisions yet about applying for these funds. I'm not aware of an imminent looming deadline as there is for the home and community-based services. But I think it's another opportunity for advocates for older Americans to think through, are there ways that we could bolster services perhaps that are already being provided, or come up with some new models to serve older people in crisis situations. Next slide. So major changes were made through ARPA to the Affordable Care Act marketplace. Remember, the marketplace is a place where people can get substantial financial help to purchase private health insurance. And it's particularly helpful for older Floridians, and when I say older, I mean 55 to 64, because the marketplace is not available for purchasing of Medicare plans. But older Floridians, that age group, are much more likely to have serious and chronic health conditions, and they face health insurance premiums 3 times higher than that for younger people. The changes to the marketplace merit their own training, so I'm just going to touch on some highlights. These are changes just for 2021 and 2022, but again, the hope is that these will be converted into permanent changes. Right now, before the ARPA changes, people with income up to 400% of poverty, that's about $51,000 for a single person, they can get premium tax credits, advanced premium tax credits, which basically gives them a break on purchasing health insurance coverage. And also many get help with cost sharing, like on deductibles and co-insurance. But even with this help, the research shows that that uninsured rates remain high, particularly for lower income people. So now with the ARPA changes, people with income up to 150% of poverty, that's about $20,000 a year for a single person, they are guaranteed to be able to go on the marketplace and purchase a plan with 0 premiums and substantial help with deductibles and cost sharing. So in addition, for the first time, people with income above 400% of poverty, they'll now be eligible for tax credits. And their premium contributions must be capped at 8.5% of income. You know, previously, there was this cliff where if you reached 400% of poverty, you couldn't get any help with premiums. So now this is really a big assistance, particularly for older Floridians who face more expensive insurance. Also, if you received unemployment compensation benefits anytime during 2021, you can get a 0 premium plan through the marketplace, regardless of your income. Because of the public health emergency, the special enrollment period through the marketplace has been extended through August 15th. And normally there's just a limited enrollment period in the fall, but because of the emergency, it's been opened up. This is quite a meaty, confusing topic, both for people who are already on the marketplace and getting help, because they may be eligible for even more help now and they can go back and get adjustments, but also for people new to the marketplace. So I recommend, if you have questions or your clients have questions, contacting the primary navigator program in the state called Covering Florida. And they can answer questions and provide free help with enrollment. Next slide. There are additional ARPA pots of funding for mental health and substance use disorder services. This is not an exhaustive list. The states will be getting a total of $3 billion more in federal block grant money for mental health and substance use disorder services. States already get these block grants, but my understanding is that with this additional infusion of dollars, it will triple the amount available to states. There's been a lot of concern about the burnout on the part of healthcare professionals. I mean, this has been an incredibly stressful time. So there's some money set aside to particularly provide services to healthcare providers. Next slide. And finally, but obviously critically important at this time, and hopefully extending into the future, is more funding for improving public health generally in this state, and in the short term to respond to COVID. Nationally, a total of $92.2 billion has been appropriated for public health purposes. We know in Florida that funding and staffing of public health activities, particularly local health departments, have been decimated over the past decade and in no way kept up with the growing needs of our population. So there are new dollars available to support a range of public health activities for responding to COVID, including dollars to shore up the workforce, such as hiring more community health workers, activities to improve testing, contact tracing, outreach, and education. Next slide. So the latter part of this presentation, I just want to turn to some key Medicaid consumer protections that are not new. They're still in effect since they were implemented last year under the Families First COVID relief bill. But these are really provisions that are front and center in terms of a safety net for healthcare during this pandemic. Next slide. So the major one is the continuous Medicaid coverage requirement. And what that is about is, Florida has been getting enhanced federal matching dollars under Medicaid since the public health emergency started, and those enhanced dollars continue. But as a condition of getting those dollars, the state is required to maintain coverage for almost just about anybody who has been getting Medicaid since March of 2020. And so this is a list of some of those groups that are protected. For example, medically needy, as many of you know, typically under the medically needy program, people have to meet a share of cost each month, and it's usually pretty substantial. Well, now, if someone meets their share of cost just for 1 month, they their coverage, their full Medicaid coverage is to be continued throughout the public health emergency. Similarly, people who lose SSI, people who are no longer meeting a disability requirement, children and young adults aging out of coverage. New mothers right now have been able to get more than 60-day postpartum coverage because of the public health emergency. Parents and caretakers who no longer may have minor children that they're taking care of, their benefits will continue, and qualified Medicare beneficiaries as well. Next slide. So there are very few exceptions to this rule. And I would say is, if you come in contact with somebody who is losing coverage during the public health emergency, it should be a red flag that, further investigation needs to be done and possibly advocacy, because it is highly likely that it's a mistake that somebody's being cut off coverage. And you can see some of the beneficiaries. Obviously, if the beneficiary dies, or if they move out of state, or they no longer want coverage, their coverage can be terminated. There's an exception for immigrant youth who now are getting coverage under a special lawfully residing immigrant coverage category, but once they turn 19, they are not able to continue their coverage unless they can figure out how to squeeze themselves into another coverage group. Of course, the exception to that is for emergency medical services. Similarly, refugee medical assistance coverage was just time limited, and that does not continue during the emergency. And presumptive eligibility coverage, which is short term and requires somebody to follow up with an application for permanent coverage. Also, this continuous coverage requirement does not apply to certain children's programs like the Florida Healthy Kids and Medicaid programs. Next slide. So every year, beneficiaries have to show that they still qualify for coverage. They have to renew their applications. And at the beginning of the pandemic, these redeterminations on the part of the state were suspended. Then they were reinstated in October, and they've been happening on a staggered basis since that time. But again, the key thing to know is even during the redetermination process, if somebody is found not eligible, their coverage cannot be terminated right now. And we understand that the Department of Children and Families automatically renewed over 628,000 individual SSI-related group cases. So that was like the beneficiaries didn't have to do anything on that, and they should be good for a year since February of this year. And we're hopeful, that some of this might, some of the streamlined procedures that the state is applying at this point during the pandemic can be made permanent down the road. Next slide. So not surprisingly, because this continuous coverage requirement, the Medicaid caseload has jumped by over 800,000 since before the pandemic. But that growth has mainly been for children and their parent caretakers. Next slide. So President Biden notified the governors earlier this year that the public health emergency will likely be extended throughout 2021. And that means, because of the lag in processes for terminating coverage, that means that continuous coverage protections will likely stay in place through January 2022. So that's great news for our clients. We're starting to try to think through and gear up for future advocacy efforts that are going to be needed to prevent, mass erroneous disenrollments of eligible people after the public health emergency ends. I mean, the last thing we want is, the public health emergency is over, and then, millions of Florida Medicaid recipients are getting notices that their coverage is ending. But mainly, we want to make sure that if the state has made a redetermination during the public health emergency, that people have an opportunity to provide additional information. Their circumstances may very well have changed once the public health emergency ends. And they should be given an opportunity to provide the state that additional information before the state acts to terminate coverage. And of course, that people still get due process rights if they're notified that their coverage will end. So that wraps up what I was going to talk about on the healthcare front. And I am now going to turn this over to Cindy.
Thank you, Anne. I'm going to start talking about SNAP, which has been an enormously helpful safety net program during the pandemic. SNAP, as I think most people know, stands for the Supplemental Nutrition Assistance Program. And it's the not so newish name for the old food stamp program. And if you're like me and a dinosaur, you will interchangeably call the program SNAP or food stamps. As you may know, as you probably do know, SNAP benefits go to low-income households who use their benefits to buy groceries at participating retailers. We used to say that they used their benefits to buy groceries at the grocery store, but now there are other places like farmers markets which have stepped up and are taking SNAP in many areas of the state. So that's important to remember, that that's another resource that people can go to try to buy their food. Folks can also use SNAP to buy, plants and seeds to grow their own food, which is a great way to make your SNAP benefits stretch if you have the growing space, or perhaps if there's communal gardening space in your area. SNAP has been a safety net program that really lives up to that name during the pandemic. In so many ways, it has almost single-handedly addressed food insecurity for millions of Floridians during the pandemic, including many seniors who face increased food insecurity in Florida. And one of the reasons that SNAP particularly matters to seniors in Florida, other than being food insecure as a group, is that over 40% of SNAP households have someone who is a senior, which for SNAP purposes is someone who is 60 or older. So it's a program that really matters to seniors. One of the ways that SNAP has played a big part in addressing food insecurity during COVID is through a temporary 15% supplement to SNAP in COVID relief packages passed by Congress and extended by ARPA. This increase amounts to about $28 more per person per month, or just about $100 per month in additional food assistance for a family of 4. And there is some good news, not to get your hopes up, but there is a possibility that USDA and the president may do an across-the-board administrative increase to SNAP that is permanent, after the public health emergency. So stay tuned for the very real possibility. We're very hopeful that an increase in SNAP may be permanent without congressional action. Florida has also been providing what's called emergency allotments to SNAP participants, which is in addition to the 15% increase. And under ARPA, this will last through September of this year. Under emergency allotments, DCF supplements SNAP allotments of current and new recipients up to the maximum for families of the household size. And we expect DCF in the state of Florida to continue to do this through the public health emergency, but it will only happen if Florida has an emergency declaration in place. So unlike some of the other relief, like the 15% increase to SNAP that I mentioned before, this particular provision of federal relief, the emergency allotments, it turns on whether a state has an emergency declaration in place also. So if Florida decides that it's going to not extend an emergency declaration, it could put this particular relief program in peril. In the past, emergency allotments only benefited families who were not already getting the maximum. You remember this probably when it first rolled out, this was a big issue. Many families, and that was roughly about half in Florida who get SNAP, were left out completely from emergency allotments because of the prohibition on anyone getting an emergency allotment if they were already getting the maximum amount for a family of their size. But the new administration at FNS has reversed this restriction, and now almost everyone will get the emergency allotment. So DCF supplements households who receive less than $95 in emergency assistance with enough benefits to get them to the $95. Households who are already receiving the maximum amount of benefits for their household size will receive an additional $95. So that's good news, and that's different from how the federal government was administering this particular program in the past. But as I said, this flexibility, emergency allotments, is only possible if the state has an emergency declaration in place. Note, though, that if Florida decides not to continue the emergency, FNS at least allows a state that has lost or will lose its declaration in the current month to provide one additional issuance month of emergency allotment. And some states are going the route of not extending their disaster declaration or their emergency declaration, and we're hoping that that does not happen here anytime soon. Emergency allotments are nothing to sneeze at. This month alone, Floridians got or will be getting about $280 million in assistance from emergency allotments. So on to TANF. In TANF, folks with children get monthly cash assistance for basic necessities. And because our TANF assistance payment levels are so low, when I say basic necessities, I mean maybe only one or two basic necessities for a family, because there's no way with our TANF allotment amount that is set by the Florida legislature, there's no way that that cash assistance is enough to meet all of a family's or a child's basic needs in a low-income family. TANF is the only cash assistance program available to low-income families in Florida. It allows children to be cared for in their own homes without being sent to foster care. So why do seniors care about TANF though? Well, interestingly, in Florida, a grandparent is head of household for about 36% of children receiving TANF. So this is very much a program that seniors care about. So the Pandemic Emergency Assistance Fund from ARPA, which is part of TANF, is very important to seniors. Emergency funding for the program for states is available for the period of April 1st, 2021 through September 2022. States had to tell HHS if they wanted to use these funds by April 25th of this year. And fortunately, Florida did elect to receive these funds. We were quite happy about that. How can the funds be used? By law, this additional money from ARPA must be used to provide households with non-recurrent short-term benefits. The benefits must address a specific crisis, like a pandemic or episode of need, and cannot be used to meet recurring or ongoing needs, and can't extend beyond 4 months. Now, although the money can't be used to cover the cost of providing regular monthly TANF cash assistance, because that's designed to help families meet recurring and ongoing needs, it can be provided in cash or in other forms of benefits, as long as it's not going to be recurring and ongoing. And good news is that under the formula for distribution of these funds by state, Florida stands to get over $35 million. And that may sound like a lot, and it is, but it can be depleted very quickly. And it's very important for the state to be strategic, to get the money out quickly because families are suffering, and to make sure that it fills a hole that other ARPA money isn't going to fill. You know, and for example, we think a quick and effective way to use these TANF funds under ARPA is to provide supplemental assistance for 2 months to TANF households. Specifically, we recommended 2 payments of about $415 each to families participating in TANF. And that was based on a caseload of roughly 42,000 folks, which has been declining slightly. But stay tuned. for how Florida will use those funds. All we know officially at this point is that DCF has told HHS that they elect to receive the funds, but we do not yet know what those funds are going to be used for, but we will obviously let people know as soon as we do find out. PBT, Pandemic Electronic Benefits Transfer, is a special food assistance program for children. It was newly created by Congress just for the pandemic to provide grocery benefits to replace meals that children missed when they didn't attend school or childcare in person. Now, originally, last school year, PEBT provided food assistance to Floridians with children who are eligible for free or reduced price school meals through the National School Lunch Program, but whose schools were closed due to the COVID-19 pandemic. Because as you recall, last school year, at the end of the school year, many schools just shut down because of the pandemic and went solely to distance learning. But when this current school year came around, more schools opened up and provided some kind of hybrid type of education for kids where they could come into school or they could do distance learning from home. So states can now ask USDA to provide PEBT in this school year, the 2020-2021 school year, to children who have a reduced number of days or hours that they're physically present, in a brick and mortar school or in childcare. And this includes students who opt for distance learning in Florida, even if their school is otherwise open as usual. For now, USDA has approved Florida to run a PEBT program to target school children from August 2020 through June 2021. Florida's plan for kids in childcare is still up in the air, and I wish I could give you some better idea of if and when that's going to roll out. It's been a struggle for states around the country in figuring out how to do this, so we're still cautiously optimistic that Florida will roll out that program for children in childcare. But why do seniors care about PEBT? Well, we know that they are in households or head of households and many families receiving safety net benefits like SNAP, TANF, or Medicaid. And in Florida, eligibility for PEBT encompasses many of these children. Eligibility includes students who attend a school that participates in the National School Lunch Program, and the school was closed or operating with reduced hours or attendance for at least 5 consecutive days due to COVID. The student can't have had access to free or reduced price meals because they're participating in distance learning. And the student has to either receive SNAP, TANF, or Medicaid, or be enrolled in a school that provides free lunch to all students as a community eligibility provision school, or the student is actually determined eligible for the National School Lunch Program by the school district because the family made an application for that assistance through their school. This go round with PEBT for 2020-2021, children will get $6.82 a day, which represents money for breakfast, lunch, and new to school year a snack. Now the money PEBT is not provided for days in which the school doesn't operate or on the weekends, holidays. The $6.82 will not come for those particular days. We know that Florida estimates that it will issue $1.2 billion to approximately 1.2 million children for school closures, and reduction in attendance and hours this school year. These benefits started to be issued on, I think it was about April 29th, and will continue over a 6-week period. For a family with just one school-aged child, benefits in March alone, if my math is correct, would be about $157, which of course is an enormous benefit to families who are struggling to put food on the table right now. Finally, ARPA allows states at their option to continue PEBT through the summer and through the end of the COVID public health emergency. we're hopeful that Florida will participate in this, and so stay tuned for that also. I just wanted to say a couple of words about unemployment insurance. Unemployment insurance is such a hot topic because it, essentially collapsed during the pandemic, particularly in the beginning. And it does matter very much to seniors because their unemployment rate continues to be higher than those in age groups aged 35 and up. So seniors really do struggle when it comes to getting employment, more so than many other age groups. And even though ARPA allows states to continue federal unemployment pandemic relief through September 6th, at least, I think September 6th. I don't know if you saw the news, but today DEO announced that Florida has withdrawn or will withdraw from the federal pandemic unemployment compensation program effective June 26th of this year. So starting June 27th, claimants are no longer going to be able to get that extra $300 supplement, although other federal unemployment programs remain in place. So we're at least happy about that. DEO says that it's doing this, it's cutting out the federal pandemic unemployment compensation part of the pandemic relief because it believes that the additional money fuels unemployment and that employment is bouncing back. I mean, there's no need for it. I will say that, hard evidence is lacking that federal relief is keeping many workers from jobs. And what we do know for sure is that many workers who are relying on federal help still face a tough time finding work in Florida. People of color, Indigenous people, women, Latinos, for example, they all suffer higher unemployment rates than average and are less likely to be able to find jobs. So they're particularly hurt when cuts like this take place. Sadly, Florida is not alone in declining these funds. It's an unfortunate trend among states. Southern states as well as Montana. In fact, I think there's now the last count where there are maybe 23 or 24 states that have opted to opt out completely of federal pandemic unemployment relief or in part, as Florida has done here. Note that one good thing is that Florida didn't withdraw from the other federal unemployment compensation programs, such as the program that allows folks extra weeks or provides assistance to people who don't otherwise qualify for unemployment, like gig workers or part-time workers. Those other programs are set to expire, though, on September 6th, unless Florida decides to withdraw sooner, and we're hopeful that it won't, or unless those programs are extended by Congress. So on that note, I want to make sure that you have my contact information and Ann's contact information. We would love to brainstorm if you have clients who you think have been unfairly treated or haven't gotten the assistance that they're entitled to, terminated when they shouldn't have been. Any of these questions that you might have about the programs that we've talked about, we would love to hear from you. But for now, I'm going to turn it back over to Kathy to see if we have any questions.
Hey, Cindy, a quick question about the emergency allotment. Did you say how long you expect that to last?
Right now, the emergency allotments are lasting through September, but we think that there's a good chance that they may be extended.
And another question. It seemed like last summer there was some special program for children who are receiving free or reduced school lunches. Is that a part of any of this SNAP this summer?
I'm sorry, can you repeat the question? I missed it.
Is there any special program for children who are receiving free and reduced lunches this summer?
Yeah, that is the program that the state has the option to provide under PEBT, but we don't have any official word yet from DCF whether they're going to participate in that. ARPA extended it through the summer at state option. We're just waiting to see how Florida reacts.
All right. And how would if a senior isn't sure if they're getting the maximum allotment, what's the best way for them to find that out?
There are links to community relations staff on DCF's websites. There are no good answers to how you get in touch with DCF these days, except to struggle through the ways that we always have, which is through the call center. Trying to, if you have a community relations coordinator who's responsive in your area, definitely to contact them. But there are links to that on DCF's website, and I can make sure, Kathy, that you get that link specifically to send out, because that's not referenced in our materials.
Okay, great. One other question related to the emergency declaration. So you're referring to the governor's declaration related to the pandemic. You said, you or Ann said some of the programs will discontinue if he withdraws that declaration. How would that work?
Well, the emergency allotments for the SNAP program would discontinue if the governor did not extend a public health emergency for the state of Florida, or another state official didn't declare one. In Florida, the chief of health for the state can declare a health emergency, and that would suffice. But I cannot, I don't know what the likelihood, though, would be of that happening if the governor chose not to extend the emergency himself. For emergency allotments, it has to be in place. Although, as I mentioned, FNS has this grace period of 1 month for states that do discontinue emergency allotments. So there would be an ability of Florida, if they choose to do it, to get an extra month, even if the state of emergency is no longer in effect.
Okay.
I'll jump in, Kathy.
Mm-hmm.
On the Medicaid side, and I know it's confusing because there's these different public health emergency orders, but for the purposes of Medicaid, the public health emergency is determined by the Secretary of Health and Human Services. And so regardless of whether the governor suspends or ends the public health emergency here, the Medicaid, for example, the continuous coverage requirement, that will really be determined at the federal level.
Okay, great. Thank you. I wanted to let everybody know that Ann and Cindy's PowerPoint is available for you to download on the Feed Loop site where their session description is. If you just scroll down, you'll see files and you'll see a copy of their PowerPoint there. As well as you'll find a link to do a evaluation of the of this session, as you can in every session. And so that concludes it for this session. And I want to really thank Cindy and Ann, both from the Florida Policy Institute, for joining us today. A lot of the things that Cindy and Ann talked about are on their website. If you go to floridapolicyinstitute.org, I think that's it, right, Cindy or Ann?
Yeah, I did want to, before you wind up, Kathy, I wanted to correct something that I said. I think I said that the emergency allotments would be over in September. That isn't true. We'll only be over in September if there's no public health emergency, and we now know that there will be, or if the state does not have a emergency declaration in place. Okay.
All right, good.
And yeah, Kathy, our website is floridapolicy.org.
Okay. floridapolicy.org, and you can find information about many of the things that Ann and Cindy talked about today. So thank you for joining us. The next sessions start at 3:45, and we'll see you then. Bye, everybody. Bye, Cindy and Ann.
Bye-bye.